Hi, Dr. Steve Knighton again from Nottinghill Family Wellness Center, going over our treatment protocol for DeQuervains or thumb pain, usually from too much gaming and or cell phone use. So most patients who come to the clinic will start with the IFC machine. We use suction pads. We get a little pattern in here, get it around the thumb area. They'll get some heat on it and about 10 to 15 minutes with that. Once the IFC's over, we go into something called Graston. Now, Graston here, we use a couple different tools. One looks like a mean Star Trek tool, and the other one's just a little, I call it my foot tool, a little piece of plastic. So the Graston actually helps break up scar tissue and remove some of the inflammation. But when I'm doing it, I can, even on my patient here who doesn't have DeQuervains, I can feel a little bit of bubble wrap, if you will, breaking down through her thumb tendon in here. So we worked that over quite a bit. It is painful, but it also feels good after, so most patients kind of like it. We'll work all the way into the thumb. The odd time we'll come into the front side, but usually keep it right up in here, getting into that joint, into that sinus area in there, and then breaking everything up through here. With the Shockwave machine, it's hitting our patient 15 times a second for between about 8 and 1,200 hits. I'll start a little further up the arm and then come right into the DeQuervain spot here in the base of the thumb, and then even work into the thumb a little bit. It gets a little tender down here because you're hitting a lot of bone, but that helps loosen up those tendons amazing across here. This is basically the new gold standard for treating DeQuervains. We'll run up here. Like I said, we'll hit between 8 and 1,200 at a rate that's comfortable for the patient, but not too comfortable. After 1,200, we turn it off, and then in most cases, I will adjust the patient's thumb. The thumb adjustments are pretty easy, except sometimes people have such problems with their DeQuervains that it's tough. I come in and a little pop, and it just pops super easy, opening up that joint, allowing it to heal and start functioning. Most people, when they finish with their first visit on DeQuervains, they come up saying they can move their thumb better. It feels longer. It feels like they could feel it again for the first time. So DeQuervains treatment. We go in with the IFC, some heat, some Graston, Shockwave it, manual adjustment. Most patients, even if it's chronic, get better between 8 and 16 visits.